Hi, I'm Dr. Chris Salierno, Chief Editor of Dental Economics, and I'm at the Yankee Dental meeting here in Boston. I'm with Dr. Jeffrey Rhode and Dr. David Fantarella. You guys had a really exciting live patient demonstration this morning. It's a packed house, went really well. Tell me, how did the patient care go? I think that's always a nerve-wracking thing. If you're going to be lecturing with live patients, did everything go swimmingly? Patients were cooperative? Procedures went well?
Patients were excellent. As I said, I think I said it to everyone. Just to do dentistry is tough. To do non-anesthetic dentistry is even tougher. To do non-anesthetic dentistry with a laser, it gets even harder. And then do it in front of a couple hundred people, that gets even worse. But it's always a lot of fun.
Yeah. And the patients did great. I mean, the best part of these when you do live dentistry is then bringing the patient up afterwards and we just have a very candid conversation with them. We go, well, what'd you think? And they all had overwhelmingly positive
Absolutely,
response.
and we've done this our third year, and I feel like we've ramped it up every year. So we really tried to give a sneak peek into what it's like to be, a Solea dentist and have the breadth of procedures, non-anesthetic, the speed, multi-quadrant, just the flexibility.
Terrific. Well, let's talk about the non-anesthesia part, because with the history of using lasers, there are dentists who may have the experience where they did have to use anesthesia, perhaps more than they figured. I'm sure you aren't using anesthesia. You don't need to use anesthesia for many procedures. There must be once in a while something that requires it, right?
Well, it kind of depends on, the laser that we were demoing this morning was Solea. It's a CO2 9.3 micron wavelength laser, and it's effective on teeth, bones, soft tissue. Mm-hmm. So there's no question that for teeth, we're doing reliably anesthesia-free dentistry. Mm-hmm. But it'll cut bone, and so when are we going to do a little bit of local anesthetic? Chances are the deeper I go, if I'm already doing an extraction, I might use Solea to trough around to get a root tip out, but they probably already have some numbing on board for that. So with soft tissue procedures, I think it sometimes just depends on how deep you go.
It does, right. So with any manipulation, it comes to it. But if you kind of have to section it out. If you look at operative dentistry, for example, it's really just a matter of walking into the operatory and kind of reviewing what needs to be done with the patient and say, would you like to do it with the laser without anesthetic? It's a yes or a no. Mm-hmm. It's I try and avoid absolutes, but it's better than 95%.
Right.
That's
so I'd go to the casino with that.
Right, indeed. So tell me about the decision point when you chose to bring Solea in. You had experimented and used lasers in the past, both of you, I imagine. What was your decision point to bring this technology in, specifically Solea?
Well, for me, it was a couple of years ago, and we went to preview the product at the Chicago meeting, and the real I guess aha moment for me is to watch it cut. Rather than working on another part of the tooth, this directly dissolves, essentially ablates hydroxyapatite. So the cutting was fast, efficient, and smooth. So all of a sudden, rather than watching sort of the slow going cut of some of the other lasers, this was approaching the speed of a handpiece. And it said, okay, well, if any of these claims about anesthesia-free are true, then we really got something here. That was a big moment.
How about for you? What was your aha, I need this?
So for me, mine was a little different. I do have a physics degree, so I've loved lasers since I was a kid. You don't need a physics degree to use lasers in dentistry, so I've always kind of been drawn to them. 2008, I started with erbium, and when it's with lasers, it's all about the wavelength, because the wavelength determines where they're absorbed. As Jeff just said, this is absorbed virtually in every tissue in the mouth, so you can ablate any tissue in the mouth. And when I was demonstrating erbium, I happened to meet Mike Cataldo, the CEO of Convergent, when he was just doing his due diligence, and I got on board and kind of, as a clinical advisor, helped them along the way, and then had the first one and most procedures, and you just get hooked. It's hard not to get hooked. The patient experience is extraordinary. It's minimally invasive. It saves time. It saves morbidity. Patients love it. It grows your practice. I mean, I guess the only downside would be the cost, but it's such a it's a deck chair off the Queen Mary. It's just a small factor in that you have one, you got to buy another because it makes it easier.
Right. Well, let's address the elephant in the room: cost. Lasers are not the least expensive decision that you can make when purchasing for your practice. How do you make the Solea work for you from a cost perspective?
Yeah, I mean, much of that comes to that, the idea of when you're managing your practice and you're going to bring in a new piece of equipment, there's some things you just have to have. And certainly Solea for me has become that, even if there wasn't a good return on investment. But the reality is that Solea kind of works for two reasons. One, you're increasing the amount of procedures you can do in an hour. I could do, at the demo this morning, we did tooth number 19 and tooth number 31. That would have been either a double inferior alveolar block or 2 appointments. So I'm going to fit it into the same appointment. I'm not waiting for that time of anesthesia. And then the second thing that we've noticed is that even surgically, now I'm doing stuff I never would have done before. Take crown lengthening, surgical crown lengthening with bone removal. I don't mean trough it, I mean actual crown lengthening. And now I'm doing that. That would have been a procedure I referred out before and not even attempted. And now, not only do we have all that being done in our office, so more procedures that I can do, that I have the tool to do, but we're seeing better clinical results from that. So you add all that up and all of a sudden we're doing more dentistry, the patients are happier, I have more patients, we have more dentistry to do, and it all kind of rolls in. So it's probably, this is one tool that probably has the best return on investment in the industry.
I've gotten so hooked on the technology and especially lasers that, we're building out our office now. We're looking at what it costs to put a chair and a cabinetry in the office. You're 60, 70, 80,000 by the time you're done with computers and everything else.
Sure.
That's one op, right? So for a laser for about 100 grand that you can roll around and can really expand your scope, make you faster and bring in new patients, I don't know, I just don't really see it as a barrier.
How did your workflows change? Obviously, as we mentioned, you're not doing anesthesia anymore, but how do you lead your dental team from assistant to front desk? How you book appointments? I would imagine this takes some changes to really optimize using this technology. How has that changed for you?
Yeah, so the major thing that you need to understand is when you're doing non-anesthetic dentistry is once you start a procedure, you have to finish it, right? So you just don't want to start it and then get up and check the hygienist and come back and just have the patient sitting there. So then you realize that, multitasking is probably a lot more inefficient than just get started and finish it. So if your patient comes in at 10 o'clock and you have some hygiene to check, you might want to just go into that patient or have your assistant say, doctor's just going to check the hygiene, he'll be in a minute, but once he gets started, he'll get you right out of here. Rather than going in and giving an injection and then checking the hygiene. But you know what? Patients love it. They feel that you're focused. They feel that you're not distracted, so you don't have to switch gears coming in and out, and then they can get up and go. So from that standpoint, I think once you turn your clock, turn your mindset, and you start to head there, it just becomes very everyday common for you. The second thing I think that's most important is you have to get the team on board. I've been practicing almost 20 years, and I always realize that you're only as good as your team. But I think it's taken the past 2 or 3 years that I realized actually how to get there. So, the whole practice is really bigger than any individual, even bigger than me. So it has a mission statement, it's defined, it's on the website, patients know about it, they come because of that. And if we find that there's a team member that's not on the wagon or they're off the wagon, then we're not going to change the practice, they have to go, right? And that comes to doctors, assistants, front desks. And then in order to determine that, everyone comes in and they virtually get treated with Solea and CAD/CAM and everything else we're doing, and then they speak honestly and realistically to the patients, and it really becomes a culture.
Right, and once you have everybody on board, the worst thing would be for someone to come in and say like, oh yeah, I heard you guys have this laser, and then say one of our hygienists says, oh yeah, that Dr. Rhode, he's always got something cool, I don't know, he's such a geek with the dental equipment and stuff. Rather than saying, oh yeah, oh my gosh, yeah, we have this laser that removes the need to have a needle and a drill. So having the staff on board is huge, and once they understand what this can do, it's scheduling things like, you see a quick class 5 in a hygiene check. That procedure takes me 3 or 4 minutes now. I don't have to wait for numbing. We can sneak them into a room, do that quick procedure, send them back. Otherwise, that would have been a half an hour scheduled at another point, anesthesia, all that kind of stuff. So we're sneaking things in there. We're also integrating more dentistry into each appointment. So let's say you have that appointment where I have to cut a gold crown off, or an old PFM, there's recurrent decay into this. They know to schedule the appointments. I mean, that's how we're doing things differently, is while they're getting numb, I'll do 2 or 3 other spots. And I'm not talking about looking for stuff that's not there. I mean, being efficient, thinking about how to set up the appointment to take advantage of the technology. When I can move in multiple quadrants, I want to do as much as I can.
So you're both doing procedures with the laser that you didn't used to do, and expanding your scope of services for your patients. Where are you getting the training for this? What kind of training does Solea provide? Where does a dentist become confident in doing these additional procedures?
Well, that's some of the training that David and I actually, we're fortunate enough to be one of the trainers for Solea, and especially with things like the soft tissue surgery stuff, if people are already doing this, there's a sophistication to the machine that makes these procedures so much more approachable. In other words, how do I cut gum tissue? We'll teach you the settings you should be at, but then you got to point it and you just watch it work. Say you're doing a fibroma, pick this up, point it here, and then you just watch it truncate it right at the base. Basically, if you're watching what's happening, the learning curve is very low with some of this stuff. And that's where training starts. You start with a full day of training that covers everything from laser physics to hands-on with the actual machine, and you're cutting teeth, and there's really awesome pig jaws that everyone loves back from dental school. And then there's even more beyond that day.
Absolutely, and I would just say that as my practice has grown, I've gone to the procedures that were more predictable, right? You want a predictable day. You just really don't have the time. I've gotten away from a lot of the surgery and root canals, and it's more just CAD/CAM and laser operative. But then as we've become more multi-specialty, because it's market driven by the patients, I've taken a look at different things and looked at how Solea can make those procedures more predictable. So for example, this morning we did an aesthetic gingivectomy and then a frenectomy, and those procedures I hadn't done since dental school. But with the laser, it just makes it so simple, it's predictable, it's manageable, it's quick. Patients are more likely to have it done because of that. You just go back and think about the traditional way you do it, and then you integrate the laser. And that's what we help doctors do.
So if I'm a dentist looking to incorporate lasers into my practice, walk me through the decision tree. What kind of specs should I be looking for when evaluating the technology that's out there?
I mean, that's a good, one of the things we talk about with any new technology to go to your practice. I mean, you want the technology to create efficiencies in your office. You want the technology to be able to expand what you're doing. I mean, some of it's doing what you do better, but it's doing more of that. And then you want the technology to also, kind of help grow and expand what you're doing for your patients. In other words, you want to have more dentistry to do. So when you're deciding then for a laser, can it do those things? Is it going to help my business grow? Is it going to let me do more? Diving down even more, then you look at, is this laser going to be reliably anesthesia-free? He said 95%. I'd say I'm at that or above. So what if that was 50%? If I'm not reliably anesthesia-free, that patient comes in the door, I don't know whether that patient's going to be the person who's going to feel it and I got to stop and numb up. Now your efficiencies are gone. So you really want to look on whether it's reliably anesthesia-free. You want to look at whether that the tool itself can do it. So for example, cut blood-free. And then when it comes down to it, it's got to be able to touch multiple facets of the practice. I mean, your thing is every patient every day.
Absolutely. So just go back to the question. You're saying you haven't made the decision to buy it. How do you make the decision whether it's right for you?
Yeah, if I had a list of all the technology with their wavelengths and all the specs laid out, how do I walk through and decide which one's right for me?
Of just lasers?
Yeah, just some lasers.
Yeah, so first of all, I would just say, what do you want to do with it? So if you want to do any hard tissue, it really doesn't compete against any other lasers because it's the right wavelength. And the other way, this is based in research that goes back 30 years at UCSF. So it's just the right wavelength for hard tissue. And then CO2 has always been the soft tissue lasers. Now you have one that's computer controlled. You can vary the depth with the foot pedal or the different spot sizes. So it is the laser. But when anyone asks me, you think it's the right time for me to buy laser, or should I do CAD/CAM first? The first thing I just ask is, do you want to do it? Because that's really all you need. And then once you decide that you are going to integrate something, you have to get uncomfortable to get comfortable. You have to change your workflow and make a commitment. And it's just like anything else in dentistry. You will have a day where you go home and you're scratching your hair, or in my case, I'm losing any more hair than I had, right? So you have to really then go back the next day and say, all right, what did we learn from yesterday? What are we gonna modify to make it better? But then you'll have the day that it just clicks, and you'll say, we could never have done that if we didn't have this technology. And then you're gonna have the next one a week later, and then the next one will come 2 or 3 days later, and then you're hooked. So, and then you start saying, well, if I could do it with that, I could do it with this, I could do it with this. So a lot of the doctors that we teach, I say, give me a list of procedures you do. I'll teach you how to interject the laser into those procedures to make them better. Mm-hmm. And then we'll take a list of procedures that you want to do, and I'll show you how to use it for that.
So let's think about a dentist who's been practicing for 10, 20 years. They may not even realize that their practice is ready for a laser, or what the possibilities are. You both have very busy, successful practices, and I know you owe laser technology to a good bit of that. So what do you think about where lasers are in the modern dental practice? What's its place? There are certain technologies we would agree are essential in the modern dental practice. And lasers have been around for some time, earlier versions of lasers. Are we finally here where we can feel confident in saying that this kind of laser?
There's just one word.
Yeah.
Absolutely.
Yeah.
So you either got to get on the train or you're going to get left behind. It really is that simple. It's digital and lasers. That's where the future's headed. Digital radiography, digital restorations, and you can, listen, when I first started practicing 20 years ago, there was a periodontist who was in the building next door to me, and he decided that he wasn't going to place implants. Okay? So he decided he was just going to do traditional periodontal treatment. How do you think that worked out for him? Right? So here's the train of standard of care in dentistry, right? Do you want to be here at the station, or do you want to be progressing with it? So it's not too late, but start looking at it. Go try it out. Don't take our word for it. Figure it out for yourself, and then don't even put your tip of your toe in the pool. Just jump right in.
Yeah, we've really seen that for people we've trained, is that if you try to dabble at the technology and take it home, and then you use it once on Thursday and not again till the following Friday, it's not going to be as much. I love what you said about being uncomfortable first, because it is a change. But is it there? I have patients that get out of the chair every day and go, that was amazing. I cannot believe you can do that. That was incredible. And so what is my response to that? Well, I said, that's great. I'm glad you had that great experience. And what their next question is, how come every dentist in America doesn't have this? So is the technology there? We finally have a wavelength that'll cut all tissue in the mouth, do things better than the drill can do, better healing than a scalpel can do. I mean, I think we're there. And the neat thing about this company is they keep improving the product. We just tested a new pattern at this trade show that is faster and smoother than anything we've ever seen. I think we can unequivocally say it's as fast as a handpiece and as smooth as a fine diamond. So, are we there? I think we're absolutely there.
Terrific. Well, so jump right into the technology, and Solea, we thank them for bringing you to this event. You guys have some more teaching to do this afternoon.
A little bit more.
Well, thank you, Jeffrey. Thank you, David. And you guys have quite a bit more work to do while you're here. Solea's got you teaching a lot of dentists who are investing in this technology. So I'll let you get back to it.
Thank you.
Thanks.